Whew. All right. Hi, everyone. My name is David Petroulis. I am from Virginia Beach, Virginia. I am currently a rising sophomore at Virginia Tech, and I am studying industrial and systems engineering. So, as the research and data compiler, it is my job to be able to disseminate information from our team and our project into various papers, visuals, and forms of media that are appealing and understandable to others, such as the video you guys are watching right now. I would first like to kick off our presentation by talking about the novel coronavirus, otherwise known as COVID-19. As you all know and understand, COVID-19 has been immensely affecting our local, regional, and global communities, leading to a multitude of closures and quarantine initiatives, as well as increased transmission and death. COVID has affected each and every one of us in some way or form, and we must do our best to prevent this from furthering. The Tech Together campaign was initiated and sponsored by the COVID Rapid Response Seed Fund and its respective institutions in order to focus on COVID prevention, preparedness, and response through the elucidation of 5 key areas. This program allows for students to focus on such topics in order to produce solutions through their ingenuity, innovation, and collaboration. These solutions then being implemented throughout Virginia Tech and the greater Blacksburg area. The Tech Together campaign's goal is to combat the coronavirus on a variety of levels, as well as assist in a safe and effective transition from closure to reopening in the fall. As members of the Virginia Tech and Blacksburg community, it is our collective duty and responsibility to keep our members safe through service and action. Our approach to combating the coronavirus is through the COVID car concept, which is a mobile testing and sampling clinic concentrating on detecting coronavirus cases, limiting COVID exposure, and safeguarding Virginia Tech and its surrounding communities. I will now hand off the presentation to our lovely team member and team leader, Amber, to talk about our COVID car concept and its significance to our community. Thank you.
Thanks, David. Hi, I'm Amber Douglas, a sophomore from Leesburg, Virginia, studying finance. As the project leader, I'm in charge of the organization and management of our team. It is imperative for a project that I understand each team member's unique strengths, experiences, and capabilities in order to create the most optimal service model, this service model being our COVID car concept. To introduce our idea, the COVID car concept is a service designed to allow for a convenient, safe, and practical method for students and faculty to be able to receive COVID testing kits. This initiative was something we found important to coronavirus prevention because in order to keep campus safe, we need to be able to keep the surrounding Hokie community safe. This concept alleviates pressure come fall that the Schifferit Health Center will experience. Not only will the coronavirus create a strain on the medical center, but it may also create a greater risk for those who enter the facility, as people being tested for COVID-19 will be in the same building as students who are seeking medical attention for other ailments. On campus, students have a higher risk of being infected or infecting. In looking for a solution for this issue, our biggest concern was to limit the exposure, but to provide a safe and easy option for students and faculty to have. The COVID car solution is significant because it addresses a multitude of areas, such as increased testing accessibility, support towards contact tracing, and minimizing the spread of the virus. It is in these areas that the COVID car will be able to assist in coronavirus preparedness, prevention, and response. Now I'm going to pass it on to Nate Dalgot, who is going to briefly talk about our product and service model for our COVID car concept. Thank you.
Thanks, Amber. Hello, everyone. My name is Nate Dalgot, and I'm from Coastal Virginia. I'm a rising sophomore majoring in electrical engineering with a minor in computer science and math, and I'm the main engineer for this project. As main engineer, it is my responsibility to focus on the materialization of our concept. I'm in charge of the design, modeling, and construction of various physical components of the COVID car concept. In this segment, I'll describe these components and their role within our concept car. The COVID car service offers a mobile sample collection through the form of a vehicle which physically isolates the driver and test provider with those who are receiving polymerase chain reaction, or PCR tests. In this vehicle, we created several mechanisms that ensure those who are driving and those who are being tested both have as much safety and protection as possible. These features include a plexiglass division between the front and the side of the vehicle. The patient will not touch doors to open them. We'll be using self-swab test kits and the construction of various chutes which will deliver the tests to the patient. And once the test has been taken, the patient will use another chute which delivers the use test to a storage container. The goal of each of these additions was to have no physical contact between vehicle occupants and the patient, or the patient and the vehicle. This would just be a quick overview of the COVID car with some pictures to help you visualize the entire process. The driver will put the test sample on the blue chute, which slides to the plexiglass panel. The patient, which is outside the vehicle over here, will grab the test, swab themselves, and put it down the green chute, where it slides back down into a storage container, which is then emptied at the end of the day to Schiffered. Here's a picture from the driver's seat perspective. It slides to the plexiglass shield. The yellow is the plexiglass. Here's the patient's view. This chute, they'll be able to see that, and they're also able to interact with the driver if they need additional instructions. The instructions will be here in white on the plexiglass, so they'll see that immediately when they get there. Once they put their test, or once they've taken their test, they'll put it down in this green chute, and the green chute will come through and leave in the storage container. And these are just some extra pictures to help you visualize the entire process and what this will actually look like once it's finished being built. So some of the budgeting for the COVID car will include necessary expenses for the vehicle, test kits, and material for those features listed above, surmounting to a total of $5,500. Aside from monetary funding, we must also have the full support of various administrative health and school organizations alongside local authorities so that the COVID car concept is known across the community as a resource to be utilized. In order to have the COVID car be updated with public health policies and protocols, we have been in contact with the Northern Virginia Department of Health, the New River Valley Department of Health, the Schiffered Health Center, and the Fralin Life Science Institute. If this service is successful, there are plans to expand the program into the greater Blacksburg-Christiansburg residential area, as well as begin a mobile testing fleet. Through detection, limiting exposure, and protecting our community, our COVID car has the capability to be successful in combating the coronavirus. I'm now going to hand it off to our final team member, Prince Wang, to conclude with why our project is necessary. Thank you.
Once again, my name is Prince Wong. I'm from Fairfax, Virginia. I am a rising sophomore, and my major is International Relations with an intended double major in EIT, Entrepreneurship, Innovation, and Technology in Pamplin School of Business. As our team's chief strategist, I'm responsible for bridging our concept into a realistic product, as well as delineate what needs to be completed by our team so that our product is successful. I serve as the primary liaison between our contacts and our team captain as well. As David stated earlier, the coronavirus has been affecting all levels of communities around the world. This includes the Virginia Tech, Blacksburg, and New River Valley areas, and it is imperative that we stop this. Through the spirit of UPROSM, we all must come together and collaborate so that we can fully serve our communities through the best of our ability, continuously encouraging the growth and development of the community as a whole, as well as for its individual members. The coronavirus has evolved into a major threat for our communities, having already hurt a countless number of friends, families, peers, and leaders, and COVID is continually to inflict harm on the people of the world. So what is our why? Our why is because we must strive to grow towards a safer and healthier future. Our why is because of our passion for service and community building, and because it is our duty to serve our community. Our why is because we need to protect our friends, families, and peers. Our why is because we need to fight to keep our communities alive, to continue their development, growth, and prosperity. Our why is because we must put an end to the global pandemic. It is only through the decisiveness of our actions will we be able to prevent our communities from experiencing more losses in the future. We must combat COVID-19, mediate its impacts, and prevent its progression. Our COVID concept has the capability to be implemented effectively, efficiently, and immediately. We must serve and continue serving to strive for a safer and healthier tomorrow. On the world stage, our service may only be that of a small ripple of change, but all ripples have the potential to grow into currents that can sweep down mighty walls. These currents have the power to inspire other communities to respond to our call of action to protect our world and sweep down the challenges and walls COVID-19 has created. We must come together to muster change that will bring the coronavirus to an end. And through service and passion, our team wishes to spark that change for Virginia Tech and Blacksburg in order to encourage our public health and safety.
Hey everyone, it's David again. So the purpose of the second part of our video is to elaborate on specific aspects of our project in order to answer potential questions and address concerns that the judges may have. This is to exemplify our ability to answer challenging questions, portray how our project results in a feasible solution, show the active steps we are taking to align with local and statewide health protocols, and conceptualize our idea and how it can realistically be put into practice. So, without further ado, let's get right into the questions. It is going to be inevitable that your project will involve biohazardous materials. Do you have a method of disposal for utilized test samples?
Through a meeting with the Schiffer Health Center, their representatives have already agreed to provide biohazard equipment and dispose of any materials through their biohazard incineration system.
How do the project members intend on creating widespread awareness of your service?
Good question. All of our team members have worked extensively on marketing campaigns. And more significantly, some have already established a pre-existing working relationship with Virginia Tech marketing and those who control and run the primary Virginia Tech accounts. We intend on streamlining a unified front between our project members, the Fralin Institute, Schiffer, and Virginia Tech Marketing to create virtual and social media initiatives to gain exposure for our target audience.
How does your team address the concern pertaining to the accuracy of PCR tests?
We have taken much consideration with the reliability of our test and can assure its reliability. Our self-swab will be supervised by medically trained personnel who will be in the vehicle and keenly observing the test administration process. Additionally, our team has done extensive research on self-swab tests themselves, and conclusive results have shown the accuracy of tests even without the presence of a medical professional. Furthermore, to preserve the integrity of the test sample through the transportation process, we will accommodate for at least daily testing drop-offs to Schiffer and cooling systems within the vehicle to ensure viral materials are stable.
What is the skill your team is looking for in terms of your project?
Our team have long considered this question and found that a major strength of our project is that regardless of our operating capacity, whether it be one fully functioning vehicle or a full fleet, the effectiveness of our COVID car will not be diminished. Currently, our goal is to accommodate mostly off-campus students and staff, but if successful, we would like to expand to the greater Blacksburg, Christiansburg, and New River Valley areas. We recognize the entanglement of Virginia Tech and Blacksburg and acknowledge that in the true spirit of UPROSM, it is imperative that we consider not only the needs of Virginia Tech affiliates, but the greater community holistically.
Why is the COVID car a better alternative than students going to medical facilities to be tested?
Very relevant question. There are a plethora of reasons, mainly relating to contact tracing, limiting exposure, and safety. No matter how small, there is a risk involved with any form of traveling if one might carry the coronavirus. Through a direct delivery between our mobile sample collection center and the test recipients, It removes many possible in-between chances of transmission. Particularly, it alleviates the stress of inadvertent transmission through asymptomatic carriers of the virus, honing in on contact tracing and eliminating additional possibility for exposure.
How will your team determine and filter those who should seek attention from a medical facility and those who should utilize your service?
This was a very big concern for us, and we have formulated several ways to differentiate the two. Primarily, we will create an intensive screening and survey process that will consider several factors, including pre-existing conditions, genetic predisposition, and many other factors to trigger red flags in our algorithm and immediately recommend the seeking of medical attention from a medical facility. This survey will be connected with extensive pre-existing research and will be created in conjunction with Schiffer and other medical organizations. We will also create disclaimers throughout our test receiving process to make sure recipients understand who should and should not use our service. We have and will continue to work with Schiffer Health Center and local health and statewide health departments to ensure the safety of our service and clearly specify who would qualify under our service criteria. As insurance, the medical personnel operating the vehicle will be carefully observing the individual through the test-taking process and will provide further recommendations as necessary.
Thank you, Prince, for those thoughtful answers. And with that, I hereby conclude the video portion of our COVID car concept. I hope you guys enjoyed watching, and I would like to thank you all on behalf of me and my team for giving us the opportunity to combat the coronavirus through innovation, ingenuity, service, and action. Thank you all so much, and I hope you all have a wonderful, safe, and healthy day. Bye!